brain-computer interface is a technology that connects the human brain to a computer, allowing direct interactions. Neuralink, a company founded by Tesla CEO Elon Musk, implanted BCI chips into a monkey's brain, which enabled the animal to play video games without a joystick. Recently, the technology has been applied to quadriplegics to show that they can operate computers with just their thoughts. To make a precise connection between the brain and a computer, the electrode technology implanted into the brain is crucial. In particular, electrodes must be able to precisely capture electrical signals from the soft brain without damaging it. So, it is critical to develop soft and high-performance electrodes. Recently, organic-inorganic hybrid electrode technologies have been gaining attention among various electrode technologies. With these technologies, inorganic materials such as silicon and metals with excellent electrical performance are thinned to a thickness of nanometers and integrated into soft organic materials such as polymers. However, even with the development of these superior electrode technologies, their practical applications are still difficult. The main reason is that a highly invasive surgery is required to implant the electrodes. On top of that, if the electrodes are no longer in use, a secondary removal surgery is necessary to remove them due to the risk of an immune response. Recently, a team of researchers has developed electrode devices that can be implanted via injection without such an invasive surgery and can dissolve themselves after use. By mimicking the structure of an umbrella, a research team led by Professor Seung-Kyun Kang at Seoul National University has developed the world's first electrode device structure that can be folded and unfolded in a small space. Only a small incision enables large area electrode devices to be unfolded, and their biodegradable materials dissolve themselves in the body after use, eliminating the risk of a surgical removal.
For packaging and injecting the device through a small syringe, we use various concepts of material engineering from material selections to designing the geometry. To package the device into a small syringe, we apply the principle of an umbrella, which has a large area when it unfolded but a small area when it folded. Umbrella consists of a central load connecting with umbrella frames, which make it possible to transform its shape during deformations. So we designed the electronic device inspired by umbrella geometry, which consists of a central node for deformation center, and a shaft for a body frame, and a support for a driving force of a shape recovery. From this design, we can easily transform the device shape without fracture during a packaging and an injection process. Also, we choose a shamer polymer as a body material of the electronic device to remain folded and to prevent the entanglement inside the syringe. We designed the shamer polymer that can suppress the elastic mobility of polymer chain at temperature below body temperature, so we can inhibit the elastic recovery of the device inside the syringe and maintain the program shape until it exposed to body temperature after being injected into the body. And the device was coated with a water-soluble lubricant so that the device can softly slide over the sticky brain surface to recover its shape. After that, the lubricant was dissolved in body fluid to make direct adhesion between the device and the tissue for reliable operations. As we combine these various materials technology, our team has developed a new concept of device that can possible to package and inject through a small syringe.
The electrode device developed by the research team is activated by the following process. When the center node of the umbrella-shaped electrode device with different sensors is pulled into a syringe, the support structure bends and the device folds in. After being packaged into the syringe, the mobility of polymer chains of the substrate-shaped memory polymer is suppressed by lowering the temperature of the syringe. The device can then hold its shape in the syringe without unfolding. When the device is injected into an environment similar to body temperature, the mobility of the chains is restored. This triggers shape recovery, and the bent support becomes straightened again, allowing the electrode device to unfold and cover a large area. Thanks to this remarkable technology, a research team led by Professor Kang has opened the door for large area electrode devices to be implanted into the brain using only a syringe, breaking away from the conventional method of implanting them through large incisions. The research team has succeeded in dramatically reducing the burden on patients of having to undergo surgical implantation of electrodes or sensor devices which were necessary to diagnose brain diseases. This minimally invasive and biodegradable diagnostic device technology is expected to be a game changer for conditions such as epilepsy and traumatic brain injury, which require in-person, short-term monitoring of brain activity.
Various types of biosignals are analyzed comprehensively over time to diagnose a disease. Traditional methods required surgical implantation of a device into the brain to monitor biosignals for a certain period. In such cases, once the disease is diagnosed, the implanted device must be removed through an additional surgery to prevent potential foreign body reactions, which places a significant burden on patients. As a result, both implantation and removal surgeries were necessary for brain disease diagnosis. Here, unlike traditional methods, our device enables continuous monitoring of various vital signals without the need for major surgery. Furthermore, since all components of the device are biodegradable, it naturally degrades in the body after use, eliminating the need for removal surgery.
Indeed, minimally invasive surgeries, which are performed with minimal incisions to reduce the after effects of surgery, are being practiced in the clinical field. The development of minimally invasive implantable medical devices is expected to bring us one step closer to the development of minimally invasive medical technology from diagnosis to treatment.
Our research is innovative in that we have developed the world's first device technology enabling minimally invasiveness throughout the insertion and removal surgery. We believe our findings are expected to play a key role in the future brain interfaces, and if the device combined with various therapeutic technology, it will provide next directions for minimally invasive medical solutions.
Recognized by the international community for presenting a new biodegradable and minimally invasive device technology, this technology was published in the journal Nature Electronics, the world's most prestigious journal in the field of devices. A device that can be folded into a syringe and injected into the body for implantation. We hope this technology will provide a new breakthrough to the invasive problem of implantable devices.